Yes, I would like to reflect a little bit perhaps on the work of the EU, how the EU is preparing basically for this whole process of reflection regarding the UNGAS declaration and the review that is taking place at the moment. I think if you look back in the last couple of years, it is, I think, to a great extent been the EU which has actually pushed also for a kind of more thorough review of the UNGAS declaration and the process. In 2006 already, the European Union tabled a resolution which was adopted in which we asked for well, a more or less independent evaluation or assessment of the progress made during the UNGAS period, so the period 1998 to 2008. The reason for this was that the EU, of course, also in its own drug policy is not ignorant of well, problems in the when it comes to the handling the drug problem. Not everything that we perceive or that we want to do, that we do in policy works. And that was one of the key reasons for pushing for a review at the UN level. We already know at EU level that things don't always work out as we plan. And at the UN level, this is even more complex because of all the differences between the regions. The EU has also proposed during the last Committee on Narcotic Drugs in the beginning of 2008 that we do want a new political declaration. So we don't want to just continue the work which was done 10 years ago. There is a general feeling also within EU member states, between EU member states, that based on the fact that the drug problems in Europe and in the world are changing over time and have changed quite dramatically probably in the past 10 years, as also Martin explained. When you only look at the HIV epidemic which is taking place, we need to look at what things need to be changed and where the weaknesses also are of the current system. So that's actually what will happen, hopefully in the beginning of next year, a new political declaration, not a change of conventions. Indeed, none of the EU member states at this moment is willing to discuss a change of the current conventions, but everything that is not part of the conventions or that's actually serving the conventions is up for discussion. That's not so easy as it sounds, but at least the will is there to look further. Now, what does it mean in practice? The process is there, the review is there. If you look at the review report, which was published by UNODC in the beginning of 2008, there are certain things which we in the EU do not agree with. For instance, the report speaks of a kind of a general containment that had been achieved over the past 10 years, a containment of the drug problem. Basically saying that we have more or less stabilized and managed the drug problem in the past years. You will make the point also in the next months that that is, according to us, has not been the case. If you only look at production of, for instance, heroin or opium in Afghanistan, which has doubled since, I think, 2004 in recent years. But also, if you look at, for instance, other indicators even on the EU markets, price of drugs, which has gone down, prevalence, which has gone up in the past 10 years, you cannot really say that there has been containment. So that conclusion we do not share. There has been progress. Conditions have been created. Probably member states have adjusted and introduced new policies. Indeed, concepts like harm reduction have been spread out in more countries than before, and show good results. But there is still a lot to do. So, what is actually the current position of the Commission, or not, sorry, of the Commission of the EU towards the C&D process in the next year? Basically, as I said, we do not touch the conventions, but we do want an assessment of the declarations, action plans, and measures adopted by UNGAS in '98. The new political declaration should be adopted, and we want a restatement, or actually we want to advocate a statement of some general principles. For the EU, it's very important that the principle of a balanced and comprehensive approach So the balance between demand and supply reduction interventions is strengthened. At this moment, demand reduction is part of an action plan, but if you look overall to the current drug control system, demand reduction doesn't have an equal status. We also think that, for instance, harm reduction should become part of overall drug policies in countries which adhere to the conventions. So a strengthening of demand reduction is a key priority for the European Union. The other principle which we adhere to, and of course it was mentioned already, the fact of shared responsibility. It is true that the countries who are basically on the consumer end of the market need to take responsibility, and the same goes for the countries on the supplier end, although this concept actually is blurred because many countries are both consumer and supplier countries. The respect for the international human rights conventions is a key issue also for the EU. This includes the right to health, but also of course the rule of law, but especially also the proportionality of law enforcement interventions. So this is a key point. Mike Trace will speak about the fit for purpose document, the adverse consequences of drug control policies. The EU thinks that you cannot have drug control if you do not respect basically the basic human rights, because it has an adverse effect probably on the compliance of people and the willingness to participate in the work. A multidisciplinary approach, coordination and cooperation is a key issue. Even after, well, I think 50 years, you can still conclude that coordination and cooperation in drugs, in the drug policy field worldwide, is not the best area of coordination. Another very important basis for the EU is that we increasingly want to see that also UN policies are based on scientific evidence and results. It means basically we should not just let ideologies or simple views, well, I call them simple, but views without a scientific basis inform policy, but it should be evidence. There's a lot that has been done in the past decade, especially in the field of demand reduction. In the field of supply reduction, unfortunately, we even have trouble in monitoring what we're doing. At UN level, we are actually happy as a European Union that we probably have one of the most sophisticated systems of monitoring in the field of demand reduction. I don't want to brag about it, but well, we can say that it's true. And you can see the reports of the European Monitoring Center in Lisbon as the evidence of that. Other regions need to develop this because it's sometimes difficult in the debates to argue over facts if we only have facts, for instance, about some regions in the world and not of other regions. And another issue which is also clearly addressed by the EU position is that when we talk about alternative development, it does mean that we try to protect people actually who are living in producer countries, and that we do not impose eradication measures that actually destroy livelihoods and rather than build them. So that's a key issue of the EU policy in that sense. There are also some discussions, of course, among member states to the intensity that we should advocate the one measure over the other and the priority between them. But that's something which will have to be discussed during the negotiation process. When it comes to third countries, you will see that there are certain regions of the world who have different views also on proposals from the EU, but also, for instance, on practices such as harm reduction. There are certain countries which are quite influential, countries like Russia, but also Japan, who have a different view on harm reduction policies. And that will be a tough thing to go by, to discuss. Also the United States, of course, has not been the greatest advocate in this area. As you know, the Commission has a very limited role in the whole UNGAS and C&D process. There is only basically one area of key competence, which is precursor control, where the Commission is acting on behalf of the EU. For the rest, it's the Member States, and the Commission can only support Member States by providing information and advice.